Can you tell your personal stories, how psychedelics changed your lives?
Yes, I've taken part in 2 clinical trials looking at the use of psilocybin on treatment-resistant depression. This was after many years of trying various antidepressants, various different talking therapies, really searching for an answer to kind of the cure, the fix, you know, try and dig my way out. I had a particularly dark period about 10 years ago, and I was desperately searching around for something new. My doctor said that he couldn't help me anymore, which made me feel even more desperate. But I kept searching for something that might help. And I came across eventually a lecture from Robin Carhart Harris at Imperial College, talking about the fact that they were looking to do a study looking at the effect of psilocybin on treatment-resistant depression. So at this stage, I was having kind of suicidal thoughts. I'd had to stop work. I was in a really, really bad place. But hearing him speak about that gave me a bit of hope that there might be a new treatment that I could try. To cut a long story short, I got in touch with the team, and it still took about a year before I was screened and accepted and then treated during that trial. But I had 2 doses on that trial, and after that, I had some really difficult experiences. Had to literally face my demons, look them in the eye. But the team around me helped me through that, and I got to a place where I was more able to deal with the range of emotions I was feeling, because depression for me was about resisting feelings, resisting thoughts, pushing them away, and it never gets rid of them, it just makes them worse. So after that trial, I had this period of at least 3 to 6 months, I would say, where I was more open, I was more able to feel the full range of emotions that I was going through. And that's having that weight lifted off my shoulders. You know, I had what they call an afterglow after the first trial, where I was depression and anxiety free, really. Everything sort of I felt lighter, things looked brighter, you know, going out in nature, everything sort of seemed to be shining back at me, not like a hallucination, but just everything felt more alive, you know. But life conspired, you know, went through, gradually that afterglow wore off, and it took me another 4 years to be able to access a second clinical trial in 2019, which was at it was King's College, run by Compass Pathways. And I was obviously desperate for the same effect, and I didn't get it. So I was very disappointed after that. However, the team again around me helped me to reframe it, and they were like, look, my depression lifted during the dose itself. I did feel that weight lifted, and it came back as soon as it was wearing off. But the team around me were like, well, the hard work begins here. You've had a reminder of what it's like to feel that weight lifted, and now it's kind of not completely on you, with support, you know, to do the work, to make those changes in my life, to help myself live a mentally healthier life, really. And that's what I've been doing ever since. So I've been off antidepressants for the last 5 years now, following that trial. And it's not always easy. It's not a magic cure or anything like that, but I'm definitely in a better place after both the trials, in spite of the very different outcomes,
My name's LEONIE SCHNEIDER, and I was first diagnosed with depression in 1998 and put on SSRIs as a first-line treatment. They were really helpful in a point of crisis, and they helped stabilize things. But I then tried to come off them, and then unfortunately depression returns. And so what I noticed is we just changed the SSRI, try a different talk therapy. And that pattern ensued for like the next 20 years. My experience of depression was never about trying to get to understand what was happening for me. I was just treating the symptoms of what was happening, trying to sort of stabilize, but never really getting to grips with what was happening and the roots of my depression. So when I had another bout of depression returning in 2019, I thought I really need to do something different, because this is no longer working. I can't just try a different medication again and expect a different outcome. It's just the same thing. And I heard mention of the second Imperial trial looking at psilocybin for depression. And went through the screening process. And it was quite a profound experience. I think at that point, I had quite a clear understanding that up until that point in time, I thought I was very broken. and that somebody out there would give me the solution, the right drug, the right talk-in therapy. I'd read the right self-help book, and someone, some way would fix me. But I had such a profound experience of turning inwards and realizing actually I wasn't broken, that actually I'm whole, and I have to unlearn some patterns, maladaptive coping mechanisms, a lot of ancestral feelings coming through that are passed down through the maternal line, and realizing actually I have what I need and within me, and being sort of more empowered to be responsible and take some ownership of the process and my own healing. Unfortunately, after the trial, I then had my worst episode of depression, because life ran away with me. There was unemployment, financial insecurity, lockdown, no getting a job during lockdown, savings running dry. It was a perfect storm. But what I hadn't lost that feeling of I have the capacity to deal with things. So bounced through that, got through that, but unfortunately again, depression returned. So I then did a second trial with small pharma looking at DMT for depression. And that was a really intense experience. DMT is quite a profound thing, intravenous DMT, possibly even more so because of extended duration. And it was a particularly visceral experience for me of my body, of my felt sense. And post that trial, I think a lot of my healing work has come from somatic practices. I do a lot of dancing now. I like beautiful fabrics. Beauty is such a value that's come into my life post that experience, and trying to treat myself with love and compassion and those around me. So overarchingly, I'd say psychedelics have given me an insight into myself, changed my relationship to depression, and inspired me to make sure that other people have access to these same treatments. So I was invited to speak on a number of platforms, invited to Professor David Nutt's Medical Psychedelics Working Group, met Ian through an integration program that Dr. Rosalind Watts was running, the pilot of her ACER integration program, and started reshaping my life in a way that was in line with my values and beauty and connection and doing meaningful work. And life has substantially changed since that point.
Now I understand that psychedelics were transformative in your lives, but why did you feel the need to create an organization for patients?
Because we've both been through 2 clinical trials each. That demonstrates many things. It demonstrates that these treatments are not a magic silver bullet. It's not one dose and you're cured of human suffering forevermore. And I think the different outcomes for us from those trials showed us that there was such a variety of experiences, even within the 2 of our experiences of those 4 trials. And we had so much valuable knowledge. So we were both doing sort of advocacy work already. We were both on working groups. We were both speaking publicly about our experiences. But we felt, I don't want to speak for you, but I think we both felt that there was more that we could be doing. There's a lot of deeper work to be done. And the idea of setting up the Psychedelic Participant Advocacy Network, or PsyPAN, was very much to create a community of people like ourselves, because then you have so much more lived experience and knowledge that you can then use, learn from. Organisations providing these trials and treatments can therefore weave that lived experience through the trial process. We can all learn, they can improve the trial models and treatment models, and it's for, again, really the better outcomes for people like ourselves. So it's a positive feedback loop, basically.
And I think an issue particularly close to my heart is the idea of actually connecting the participants to each other. So we're feeding back into clinical trial design and treatment design, but actually what we found after doing the psychedelic trials, that sometimes you come out feeling even more lonely and even more isolated because you've been through such a profound experience. You might return to families, social networks that don't understand what you've been through. They might not even understand the changes. They might not even recognize you anymore. And there's something quite particular about going through a psychedelic clinical trial. It isn't just another drug trial. It's a powerful transformation. There's a strong therapeutic component, and actually just finding other people who've been through that process. So delighted that at ICPR 2024, we launched a report identifying 6 key actions we believe organizations can take to ensure that they're patient-centric. And one of those is the need to address this loneliness and isolation. And delighted to say we're launching a pilot peer support program. And we hope to connect participants to each other to share their experiences and provide peer support.
Yeah.
Do you feel included as patients in this conference?
Yeah, we spoke here 2 years ago, and it was the first ever time there'd been a fully participant-based panel. You know, everyone on stage, we were with a guy called Pedram Dara, who I think is here and used to be part of the Open Foundation himself as well. He really pushed for that. So for that to be the first time that's ever happened at a psychedelic conference is amazing. But the difference in those 2 years has been profound, really. So we were on stage giving our presentation about the importance of the participant voice, really calling out to the sector, like, work with us. You know, we have this lived experience, we have this knowledge. We need to safeguard participants as well as we possibly can. We need to learn from those experiences that there's certain things, because you're in such a hyper-aware state, that smallest nuances can have such a huge impact on people. So it's really just, being able to convey that to organisations that are providing these trials and treatments. And after that, over the last 2 years, we're now on stage 2 years later, presenting a report where we have worked with an organisation with a view to showing the rest of the sector, this is how it's done. This is how we work together. This is the really important, deep work we need to do together to help safeguard future participants. So yeah, it's been very open, I would say.
Delighted to see that there are a number of panels besides the ones we're on. We have there are participants here speaking about their MDMA therapy for PTSD. There are participants here speaking who were actually classed as non-responders on clinical trials, and her amazing transformation and how she has ultimately responded to the treatments. So having a platform such as this, to have those voices, you know, aside from ours, they're both, those lovely, wonderful participants are part of our network, and being able to support them to also take stage and have their voices heard. So absolutely wonderful.
Yeah, I'd say if there's one organisation or conference that's aware that there is a human life behind every single point on every graph from every academic that presents here, it's open, it's ICPR. You know, they do fully understand that we're talking about real people, real people's lives, their futures, etc. It's not just about this, you know, we're not just guinea pigs that are put ourselves forward for scientific research. You know, we're people that have been suffering sometimes for decades, not responding to any treatment at all. You know, they understand how important it is to see the human side of it as well, and to convey that to everyone else here.
There are many patients who are desperately waiting for having legal access to psychedelic treatment, but there are also people who say that we move too fast and we need to ensure ethical standards and the evidence base. How can we find a balance between the two?
Yeah, I mean, it's nearly 10 years since I took part in my first clinical trial, and my hope was that by now these treatments, if proved to be effective, would be widely available and accessible to people. I realise now, particularly with what's happened this week, it's going to be a while longer. But with all of that said, I think it's really important that we do this in the right way. If we do rush it, if we do make mistakes, if we do what many... There's a lot of talk at the moment about removing the therapeutic element from psychedelic-assisted therapy because they can't regulate it properly or because it's too expensive, I think is an underlying thing as well. If we remove that, I think there's a huge safeguarding issue. We will then get loads of stories where people are just cast adrift at the end of the trial, can't make sense of their experiences, maybe in a worse place than they were before, you know, and then everything goes off the rails and we lose this golden opportunity that we've got now. If we do this right, I think there are many people whose suffering can be alleviated by these treatments. If we get it wrong, these treatments will never become available. I think it's really important to say as well that those people like ourselves who have responded to these treatments need to have what's called compassionate access to the treatments on an ongoing basis afterwards. So if you can imagine being in a hole for 20, 30 years, you find something that helps you. It's not a miracle. You need therapy around it. You need help. You need to do integration. Something finally lifts that cloud. And then the only way you can access that again is to break the law. potentially in many countries anyway, or afford to be able to go to a country where it is legal. It's an ethical issue, definitely. I think we need to have that access on an ongoing basis for people like ourselves who have responded well to it. And then once the science is ready for it to be rolled out more broadly, then more people can access these treatments in the right way.
I think it speaks to that tension that is quite unique in the psychedelic space, where people coming on the trials, it's not an unknown drug that they're trying to access. People have been using psychedelics for millennia, and there is a hope that they'll have access to a treatment. So there is this expectation. People are really wanting to get access in a safe and supported and well-held way. And so it isn't unlike an ordinary trial where people are just conducting. There is something about managing the expectations of participants. And dare I say, it's something for us as an organization to then be communicating to participants and to prospective participants. There's something about a psychoeducation program here about what needs to happen and how to ensure people have the information they need, and not to take matters in their own hands. That's the other risk we have with this, because people can find these substances elsewhere and then access them in unsafe and unheld ways. We do need to go slow, we do need to go steady, and we do need to make sure that people know that this isn't just about taking a substance somewhere. It's it'll come in good time, and just maybe even that hope is what we can offer at this point.
You mentioned the importance of integrating psychedelic experiences. Do you think that the NHS, the National Health Service, or other national health services in other countries are prepared to deal with patients who undergo psychedelic therapy?
It's really hard to say. I mean, different healthcare systems will be more responsive than others. I know that the healthcare system in the UK is overwhelmed. Accessing any mental health support is virtually impossible for many people unless they've got to the crisis point where they're at risk. Their life is at risk. But do I think there are ways of remedying that? Yes, I do. Do I think there are ways of having maybe referrals to external integration groups or integration, therapists or whatever? Yes, I think there's a way through this. There's a critical mass of people that are really trying their hardest to make this happen. And I think this is the point where we need to draw upon that. We need everyone to work together. And I think there is a way of making that possible without draining, the NHS too much. I'm sure there is a way. And we're also, with the peer support pilot that we're going to be starting soon, it's another really vital form of ongoing support. It's not therapeutic support, it's just people meeting other people and being able to discuss their experiences without worrying that somebody's going to reject them, roll their eyes, just be like, what are you talking about, So I think there are ways to make this work. We have to find ways to make this work because we have a mental health pandemic. So many people are suffering at the moment. We need these additional tools and we need them to be delivered in the right way. And I think it's possible. Have to have that hope.
Yeah. So integration, I think, is not something that just happens in a set session or a set number of sessions. It is an ongoing and lifelong process, coming in many guises. So you're speaking to what kind of therapeutic integration support might there be. And I think we as an organization would really have to say there had to be a basic minimum of therapeutic support, integration support. But I think people will need more than that. And then we can have a discussion about, well, what does that look like? Is it nature-based practices? Is it yoga? Is it mindfulness and meditation practices? We're constantly integrating not just psychedelic experiences, life experiences, death, loss, moving country. There are things we need to process. And I think there's something and some work that needs to be done at a community level of building, for me, depression is a disease of disconnection from self, from others, from your community, your world, the natural world. So I think a lot of integration work is about reconnection, and that is beyond the clinical room or the therapeutic setting. It's about taking those steps and doing community building, and I think peer support's a large part of that. We can help each other identify ways of connection, activities to do together, and I think that'll go a long way to helping embed good mental health practices and positive longer-term outcomes.
Yeah, and they talk about there not being enough white coats in this area. Well, peer support is run by people like ourselves, and the more people that go through clinical trials, the more who will want to be able to help facilitate peer support spaces. That is scalable in it, in and of itself. There'll be more people going through these trials and treatments, more people to hold those spaces, more people to join and create those communities.
Do you include patients in your network who participated in treatment programs at unlicensed centers or ayahuasca sessions in the Peruvian jungle?
We don't cover sort of ceremonial spaces at the moment. We represent people who have been through the clinical trial process or access the treatment legally, so the ketamine clinics. But by and large, I think at the moment we have people who've gone through the clinical trial process, and it's across conditions. We've had people who've had opioid addictions, alcohol use disorder, anorexia, depression, treatment-resistant depression, and then across substances, we've got people who've had MDMA, psilocybin, ketamine, DMT, but yeah, all accessed in the legal clinical context. Yeah, and I'm really inspired by the sort of mycelial way of working. I mean, launching our report, we were working with an organisation to develop that together, connecting with other participants. I think, you know, if there's ever going to be a space or an industry or a healing area where you can connect mycelially and be the change you want to be, like, you know, take our guidance from the mycelial network. So yeah, please connect with us.
Yeah, a psychedelic way of working.